wash my hands to prevent the spread of infection. Um, Hello, my name is Nicholas. I'll be your nurse for today. Can you give me your name and your date of birth?
Zachary Austin, 11/23/98.
All right. So I'm going to be conducting a head-to-toe assessment on you. I won't be going over every area, but I'll be going over most. And if you have any questions, just let me know. I've gone ahead and gotten your vital signs. So your temperature was 98 degrees Fahrenheit. Your pulse was 80 per minute. Your respiratory rate was 24 per minute. Your blood pressure was 110/70, and your SpO2 was 98%. Are you in any pain right now?
Nope.
Okay, good. So I'm gonna assess your LOC first, your level of consciousness. I would say that you're awake and alert. Can you tell me where we are right now?
Our house,
And what time is it?
around 6:30 p.m.
All right. And I would say that you're oriented to your person because you gave me your name. And can you tell us why we're here? What's the situation?
Doing a physical assessment.
All right, great. So I would say that you're awake, alert, and oriented ×4. How would you say you're feeling?
I'm in a good mood.
Okay, I would say that your mood is appropriate. So the first thing that we're gonna do is a head and a neck assessment, or that's the first part we're gonna cover. So first I'm just gonna kind of take a look at your hair, kind of your skin, just look at some various things. So your skin is warm, your skull is normocephalic and symmetrical. The scalp is dry, there's no lesions. Your hair was brown, dry, curly, no signs of parasites, and it was evenly distributed. I would also say that the scalp's color is lighter in complexion than the skin of your face. So that kind of covers your scalp. I would say that the skin of your face is pink and it's uniform with the skin of your neck. No skin lesions are present or tattoos. Your facial features are symmetrical. Your eyes are the upper third of your face. Your nose is the midline and your mouth is the lower third. Your neck is symmetrical. I'm also gonna here just feel your carotid pulse. All right. All right, let me also just take a listen. All right, I would say your carotid pulse was 2+, equal bilaterally, and there was no sign of bruise. I'm also going to palpate your lymph nodes. So first, we'll feel your preauricular, and if you feel any tumors, just let me know. Postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, and then your supraclavicular. Feel any tenderness? Okay. So next, I'm just going to kind of look at your eyes. I'm just going to inspect first. Your sclera are white, your conjunctiva are pink. Also, there's no scaling, drainage, or lesions around the eyes. Your lashes are everted and they're evenly distributed over both your eyelids. Also, I'm going to look at if your eyes are reactive to light. I'm just going to quickly go over them. Okay. How can you look at the end of the pen? All right. So your eyes are, or I would say I just assessed Perla. Your pupils are equal, round, and reactive to light and accommodation. Also, if I was in a clinical setting and I was using an ophthalmoscope, I would use it to look at the inner structures of your eye. Some of those would be the retina, the optic disc, or blood vessels that are in your eye. So now I'm going to just look at your ears. Your ears are symmetrical, no signs of lesions, drainage, or piercings. Also, you just feel them. They're elastic and warm. Also going to feel, just tell me if you experience any tenderness. Okay, so no tenderness over the tragus, auricle, or mastoid process. Now I'm also just going to use my pen light to look in your ears. All right. I see a little bit of cerumen, but no foreign bodies, which is good. Again, if I was in a clinical setting and I was using an otoscope, I would use that to look at your tympanic membrane, also known as your eardrum. So next, let me just use my light to look up at your nose. So the septum is deviated, the nose is midline. Can you cover one of your nostrils with your thumb and blow out the other? Or can you do the same with the other? All right, so your nostrils are patent. Also, let me just feel these. I'm gonna feel your frontal and maxillary sinuses. Feel any tenderness? Okay, great. So, next, I'm just gonna take a look at your lips. They're symmetrical, moist, red, with no cracking or lesions. Can you open your mouth for me? So I'm just kind of taking a look at your throat, everything. Your teeth are all present, white, they're straight. The patient has no tonsils. There's no swelling or exudate present for the pharynx. Can you lift up your tongue? So the dorsal part of the tongue is rough, pink, and moist. And then the bottom side of the tongue is glistening with veins. It's kind of blue. It's also moist. There's also the gums. The patient's gums are moist, smooth, no lesions. And the mucosa is smooth, pink, moist. Also the hard and soft palate. Hard palate appeared white, firm, with transverse rugae, and the soft palate appeared pink, moist, and smooth, and it looked like it was moving. So, all right. So now, as part of the peripheral vascular assessment, I'm just going to kind of like feel your arms. So let me just look at your arms a little bit. Just going to kind of feel down them. Your skin is dry. Your arms are warm. Good skin turgor. Let me see your cap refill. Less than 3 seconds. Your nails are trimmed, convex, translucent. The skin around the nails looks healthy. The nail beds are pink. No clubbing present. The angle is less than 160 degrees. So also, I don't see any edema or any varicosities, and I didn't see any lumps. And did you feel any tenderness when I was touching your arms? Okay. Also, let me just feel your brachial pulses. All right. I would say for both, they were 2+ equal bilaterally, and they had a regular rhythm, which is all good. Okay. So now we're gonna look at your thorax and your lungs. So I might have to have you move a little bit for this. So first, I'm just gonna kind of look at your thorax. Look at your back a little bit. I'm gonna feel your chest. Tell me if you feel any tenderness. Okay. And let me kind of come around your back a a little bit. Okay. Feeling tenderness?
No.
All right, so I'm also just gonna check your skin turgor under your collar, and it's good. There's no tinting. You can tell that the patient's spine is midline, and it's got an S shape when viewed from the side. The AP to transverse diameter is 1 to 2. Also, I didn't feel any lumps when I felt for that, when I palpated his chest. Now I'm gonna need you to say 99 when I put my hands here, so.
99, 99, 99.
Okay. No tactile fremitus. Also, I'm gonna need you to take a deep breath. Exhale. Okay, good. That means chest expansion was equal. All right, so now I'm going to just percuss in 10 different locations. Skip by. Okay, that's good. I'm also, so did you feel any tenderness?
No.
All right, so I'm also just gonna listen in 10 different places. Just take deep breaths. All right. Vesicular lung sounds are present in the peripheral lung fields. No adventitious sounds were heard, and the vesicular sounds are greater on inspiration than expiration. I'm also just going to go ahead and listen to kind of under your arm, so if you could kind of lift this arm for me. All right, now let's do it the other side. All right, sounds good. Now I'm gonna kind of need you to turn your back towards the camera. We're gonna listen in 10 places on the back. Sorry, I had to pause the video because I misplaced my watch. So starting back on cardiovascular. So first I would just inspect your chest area, and I would say that I don't see any heaves, lifts, or pulsations. So let me look with the light. I still don't see any lifts, heaves, or pulsations. I want to go over some different landmarks for listening to the heart. You have your aortic area over here. It is at the second intercostal space and the right sternal border. You have the pulmonic over here, which is also at the second intercostal space, but it's on the left sternal border. You have Erb's point, which is at the third intercostal space and the left sternal border. You have the pulmonic, which is a little bit more down here, and it is at the fifth intercostal space in the left sternal border. And then you also have the mitral, which is at the fifth intercostal space, but it's at the mid-clavicular line, which is around here. So I'm just going to listen to these different points. You can breathe normally. I'm just listening to your heart. All right. So I could hear S2 better at the aortic and pulmonic locations. I could hear S1 and S2 both at Erb's point, and I could hear S1 better at the tricuspid and mitral areas. So now I'm just going to listen to your apical pulse for a full minute. So that will be at the mitral area. All right. Your pulse was 88 during that minute. Also, I'm just going to feel. So the point of maximal impulse isn't palpable. I'm also just going to listen for just a second about the bell. All right, so I'd say the rhythm was regular. I didn't hear any murmurs or abnormal sounds. So next, so now I'm gonna take a look at your abdomen. So if you can lay out for me. So we're gonna start with just inspection. So I'm gonna cover your abdomen. All right, so first I'm just gonna kind of look at your skin. I don't see any scarring, piercings, vascularity. I also don't see any rashes or lesions. I'd say that the hair is evenly distributed, the abdomen is rounded, the umbilicus is mid-line and retracted. I would say I can't see any visible peristalsis or pulsations. So now I'm just going to auscultate your bowel sounds. So I'm starting the right lower quadrant. All right. Bowel sounds were active in all 4 quadrants. I'd say that they were normal. I'm also going to just kind of lightly palpate each area and just tell me if you feel any tenderness. So I'm first palpating the right lower quadrant. In this area, there's the appendix and part of the colon. All right, so I'm gonna move up to here. This is the upper right quadrant, or the right upper quadrant. In this area, there is the liver and the stomach. Here's the left upper quadrant. The left upper quadrant has the pancreas, left kidney, and the spleen. And then the left lower quadrant, it has parts of the colon and parts of the stomach. You felt no tenderness? All right, good. All right, so now I'm gonna finish by looking at your legs. I'm just gonna pull this up slightly. Just kind of feel down your legs. Skin is dry, warm. Skin turgor is good. Skin is pink and is uniform with the rest of the body. Hair is evenly distributed. No lesions, normal lumps or edema, no vascularities. Yeah, so then I'm going to first feel your posterior tibial pulse. All right, they're 2+ equal bilaterally. And I'm also going to feel your dorsal pedis pulse. They're also 2+ equal bilaterally with regular rhythm. I'm also just going to take a look at your nails. The skin around the nails looks healthy. The nails appear to be trimmed, convex, translucent. Nail beds appear to be pink. No clubbing. The angle is less than 160 degrees. Let me check cap refill. Cap refill is normal with less than 3 seconds to refill.